Welcome. Let's talk about media and communication. In the COVID-19 pandemic, the story of India's social health activist workers that demanded fair wages and better conditions went unnoticed. Today, we focus our episode on the poor health infrastructure in India and the challenges faced by frontline workers, especially women, who play a very important role in community-level healthcare. Usha Raman, from the University of Hyderabad in India, will let us know more about how the care work performed by these workers was portrayed in mainstream media. We explore how media coverage overlooked their contributions, and we also reinforce the need to recognize and value women's caregiving work at all levels. As always, Rodrigo Silva here. Let's talk about media and communication. Usha, welcome to our episode.
Thank you. Thanks for having me.
So right in the beginning of your article, you write, we argue that care work, whether paid or unpaid, is positioned through media discourse as a natural and routine part of women's work, thus reinforcing a normalized construction of such work as gendered and simultaneously of high social yet low economic worth. Can you elaborate on this and about the importance of the study that you conducted?
Yeah, thank you for the question. So basically, it's not just at this point in time that women's work has been problematic in terms of how it's been valued economically in all discourses, whether you're looking at health or family, family economics. We find that care work it's been valued notionally in the sense that, women are praised for being amazing mothers, amazing caregivers. And when it comes to healthcare, you find that becomes then a triple burden in a sense on a woman, right? So as a working woman, feminists have for long talked about the double burden. That is, a woman bears the burden of care at home and of work outside the home. But when it comes to women health workers, there's the additional burden of care, which is an invisible part of the work that she delivers in terms of providing health to communities. And so that's really the core of our argument, that the care work that these volunteer workers do, so-called volunteer workers do, goes economically unnoticed.
Of course, I want to explore a little bit more this. So what were you hoping to find specifically? Let us know more about the research gap. Can you elaborate on that?
Yes. So, if you look at the paper, you'll find that we draw on two broad frameworks. One is the feminist economy of health, feminist political economy, and the everyday political economy of health. And what we felt, or what we were seeing through the pandemic, was there was a lot of celebration of the fact that frontline workers were doing so much, amazing work, that they were taking risks, that they were going into communities and providing care. And so the expectation was that the media would use this opportunity to perhaps look a little more deeply at what exactly was going on in terms of women's work in health. And the pandemic in many ways did open up our minds to different ways of thinking about health. And so we thought this would have been an opportunity for the media also to reframe the way women healthcare workers were doing their jobs and how we needed to value their work. So the research gap, in a sense, it was more of a knowledge and a perception gap. I think that we were hoping that media coverage would actually bridge. And so we went in wanting to see how the media had covered these issues.
A perception gap. It's interesting. Let us know more about the findings then. Let's jump into them.
Okay. So the way we did the study it was a classic media framing study, in the sense that we looked at two major newspapers in the country, and we wanted to see how they had covered women workers, particularly during the COVID pandemic. And so we did a textual analysis, in the sense we first did a search using keywords that would yield or would allow us to harvest articles that talked about women workers, in relation to the pandemic. And we came up with a corpus of, around 200 articles. And then we read these more closely to see how they had framed women in work, what kind of language was used to talk about the value of their work, if in fact the value of their work was talked about, what sort of terms were used to describe the women and their work. So that's how we went about it. So what we might call a classic framing analysis of media. And what we found was a little disappointing, but perhaps not surprising. We found that, there was a lot of mention of these women workers. In India, we call them ASHA workers, that is, accredited social health activists. And they're actually not, they're supposed to be volunteers, but they're paid a very small stipend in some states. And in other states, they are paid an incentive-based wage based on the number of homes they visit, the number of deliveries they assist in, vaccinations, those kinds of things. So they're really very low paid at all times. And what we found through our analysis was that there were two broad narratives that emerged in relation to how these women were covered in the media. And the first narrative was again, it was a complex narrative, but it was one where women emerged as victims of the system. And this was sort of a double-edged narrative, right? So what was happening during the pandemic, and again, this is not just in India, but I think globally, it was found that during the pandemic, women became particularly vulnerable, not just because they had less access to healthcare, but also because they ended up, becoming much more vulnerable to home-based violence, domestic violence, etc. So while that technically doesn't fall under the purview of our study as about healthcare workers, what ended up happening was very often where the stories talked about women, the victimhood was spread across categories of women. So there were three categories of victimhood that emerged. One was, physical health-related vulnerabilities that women were more susceptible to. And then the second was domestic violence. And the third was economic distress. Now, how does ASHA work, or how do the healthcare workers fit into this scheme? Very often the healthcare workers were also seen as victims of the system without necessarily providing an answer to how this victimhood should be addressed. The second narrative that emerged, and perhaps this was the more dominant narrative, was women as selfless heroes. And again, this echoes the findings of how women are portrayed, particularly women in caregiving roles are portrayed in other situations, in that it shows caregiving as a natural part of women's work, not acknowledging that during the pandemic, actually, ASHA workers were not only reaching out to communities about, precautions to take, safe social distancing norms, those kinds of things, but they were also providing psychological and emotional care to families, particularly in vulnerable communities. But this was often marked as something that, was to be celebrated, but not necessarily compensated. So those were the two broad things that we found.
And very relevant now, I think, from all you found, is to explore the potential or existent already potential policy impacts. What are they?
Well, during the coverage of the pandemic, we searched for articles, not just news stories, but also editorial pieces. And interestingly, there were just a handful, just about 3 or 4 editorial pieces that use this opportunity, use the focus on the context of healthcare to talk a little more about systemic issues, including issues of gender within the healthcare space. And so there were some people, particularly senior women scientists with the WHO and in senior health administration in India, who did in passing talk about the need to look at particularly ASHA workers more carefully and to recognize the care burden that was falling on them during such pandemics or during health emergencies. But 2 or 3 articles in the space of a year is certainly not enough to impact policy. So the hope is that by making visible the fact that these were issues that were not covered, that Perhaps we can nudge people in health administration, people in health systems reform to think more carefully about what it means for women at really they're at the bottom of the caregiving ladder in terms of the health service delivery chain, and what it means for them to provide such care with little or no compensation. So I think what we've done is just the beginning in terms of bringing awareness to the issue, and we're hoping that those who have more role in policymaking will pay attention to the work.
Of course. I'm curious to know more, and I think you started to touch upon that a bit. I'm curious to know more about future research venues. So where do we go from here?
So, of course, what we've done is just look at the media and look at a very narrow slice of the media. I think where we can go from here is to do a little more ethnographic work, to talk to ASHA workers, talk to communities to see how they're perceived, and possibly also work with health economists to try and find if one can actually estimate the value of caregiving. And that's a long road, of course. And, I think feminist economists have talked about it in other contexts as well, that, we really need to place an economic value on emotional and psychological care that women provide, not just in roles that are defined as caregiving, such as the ASHA workers, but also in other roles where there is a significant emotional or psychological care component. So I think working with health economists, doing a little more ethnographic work, perhaps looking at other media forums, right? Community media, to see if those are spaces where one can possibly change the way, the perception gap can be closed. So these might be other ways in which the work can be taken forward. So what we've done is really lay sort of a broad, define the landscape. And now we need to go in and pay more attention to the details of that landscape.
Promising venues for the future. Usha, can you share some relevant resources that helps us and the listeners understand and engage with this topic further?
Yeah, so we've referred actually to a lot of the literature in the paper, and I would suggest that listeners can go back to our reference list and look at some of those pieces. Specifically, I think work done during previous pandemics, but previous health emergencies such as Zika and Ebola. And that's where some of the, seminal work has come out of. So Sandra Harmon's work and, the work that WHO has been putting out on gender gaps in health and healthcare delivery. I think those are good resources, but also to look at some of the work on feminist political economy that the ILO has been doing, which recognizes the burden of care as something that we need to seriously consider and figure out how we as a society really value both economically as well as in social terms.
Well, that's good. And for our listeners that are watching this episode on the Let's Talk About Media and Communication websites, below the video, you can find the recommended materials that Usha just suggested to further explore the topic. And now, Usha, to close this episode, the end of your article, it has a very important message, too long to say here, but basically reads that we need to value healthcare and remove its gendered associations, and then incorporate these perspectives into journalism training to foster a deeper understanding of social issues. So is this the main message of your article, or is there something more you want to add?
Well, I would say that, since both Sumana Kasturi is my co-author, Sumana and I come from a media studies background. We hope that the work we do will go back to inform the practice of media. And I think a lot of our attention was on how the media covered this. So if we want to start to address that perception gap, it has to start with the media. So definitely, I think, training journalists on understanding the nuances of healthcare, on appreciating the gendered aspects and how they need to think about them could probably help.
Thank you, Usha.
Thank you.
This podcast is powered by Cogitatu Press. You can listen to this episode on the Let's Talk About Media and Communication website, on Cogitatu Press YouTube channel, and whatever you get your podcast.